Some ominous developments out of China on a new illness. Officials there have just confirmed the first human-to-human transmission of coronavirus. It's a huge story. The number of people infected with the new virus tripled over the weekend. Arthi Pole is working on this. What are the details, Arthi?
So what we're hearing this hour is, in fact, that officials within China are, as you stated, they are confirming that there has been human-to-human transmission of this virus, specifically in a province in southern China, that a relative there, media, is reporting that a family member contracted the disease and it was transmitted human to human, also saying that some medical workers have tested positive to coronavirus, a respiratory illness. And essentially what makes this a huge development is that it makes it more difficult to contain the spread when human-to-human transmission is a factor here. Now, we do know that essentially this was an outbreak that started late last year. It initially was believed that it was contracted at a food market, at a meat market, seafood market rather, and that was in Wuhan province, and that's in, or Wuhan rather, in central China. And now we're learning that it spread to southern China. But that's not it, because also the numbers are important to look at. If we can quickly pull up what the latest numbers are in terms of cases and number of people who've been killed. More than 135 new cases were confirmed in China just over the weekend. 3 deaths have now been confirmed, and that makes a total of more than 200 people who have been infected with this coronavirus. There have also been some cases confirmed in South Korea, Thailand, and Japan as well. Now, a lot of health officials raising alarms in particular around this virus because it's from the same family as SARS. And you'll remember that back in 2002, 2003, roughly 800 people were killed globally due to that specific respiratory virus. Now, in terms of containment in China, there are some fears right now because it's the Lunar New Year. There are going to be hundreds of millions of people traveling domestically. And that is why there are, in fact, new measures taking place on aircraft and at airports. And we do have some video to share with you that was tweeted out by a reporter who works for a local news agency in China, unconfirmed by CBC News. But you can see in this video that there are healthcare workers here who are, it appears, taking the temperature of some of the passengers. And this is just one of the measures that they are taking right now in order to try and prevent the spread of this coronavirus. Again, though, we're looking at more than 200 people already infected, Suhana.
And what precautions has Canada put in place, Arthi?
Well, it's interesting because we've heard from the public health agency here at home, in fact, that they say that they believe there's going to be a limited risk here for it to be spread. But they are also implementing new measures at some of the major airports within Canada, saying that there will be screening questions at kiosks. There will be messaging on screens also at arrival gates. Those are just some of the measures that will be taken by specifically the airports here, by border control. And also we want to just share with some of our viewers some of the other travel advisories that exist right now, and that is that travelers should avoid high-risk areas such as farms, live animal markets. In addition to that, they are also saying that people should be precautious when it comes to contact with animals like pigs, chickens, ducks, and wild birds. And finally, one more precaution that is being highlighted right now, and that is avoid surfaces with animal droppings. Again, though, there is now this risk of human-to-human transmission that was confirmed by officials, Suhana.
All right, you'll watch for further numbers and reaction. Thank you, Arthi.
You're welcome.